Hello, I'm Dr. Darren Anderson, and I'm the principal investigator and lead author on the study Improving Pain Care Through the Implementation of the STEP Care Model at a Multi-Site Community Health Center. This study is focused on implementing the STEP Care Model to improve the way primary care providers manage patients with pain. There's over 100 million people in the United States that suffer from chronic pain, and the evidence suggests that the vast majority of these seek care from a primary care provider. However, primary care providers are not well trained in how to manage chronic pain. Studies have shown that providers coming out of residency or medical school have very limited confidence in their ability to take care of chronic pain effectively. So Project Stepping Out was intended to address this deficiency and to provide primary care practices with the tools that they need to better care for the patients that they're seeing with chronic pain. This project was conducted at the Community Health Center Incorporated, a large federally qualified health center in Connecticut, and cares for approximately 150,000 patients across the state. The STEP Care Model was the intervention for this study. The STEP Care Model, as applied to chronic pain, suggests that patients with pain should be managed by primary care providers with basic assessment and treatment, with additional resources applied as they increase in their level of complexity. For this project, we implemented 6 specific interventions designed to help primary care providers have the tools and resources needed to manage the patients that they were caring for with chronic pain. We used several data collection methods to get as comprehensive an assessment of the impact of this intervention as possible. First, we administered surveys to primary care providers assessing their knowledge and self-efficacy regarding pain and pain care. Second, we conducted detailed chart reviews to evaluate the quality of documentation and adherence to guidelines for pain care. And third, we conducted queries of the electronic health record to collect information about patients with pain. So the results of this study were encouraging. We saw several significant improvements in process measures that suggest that the intervention was having the desired effect. First of all, we saw a statistically significant improvement in knowledge scores using a validated survey to assess primary care providers' knowledge about pain. Second, we saw an increase in the number of providers who agreed with the statement, "I am confident in my ability to manage chronic pain." Third, our chart reviews revealed improvements in documentation using the templates that were provided as part of the intervention. Fourth, we saw increases in the use of urine toxicology screens and opioid agreements. And lastly, we saw increases in referrals to behavioral health. So in summary, implementation of the STEP Care Model in primary care resulted in several significant and measurable improvements in a variety of outcomes. We saw that primary care providers' knowledge and confidence to manage pain improved, while their adherence to documentation standards and opioid management guidelines also improved. These findings are encouraging and suggest that primary care can play an important and meaningful role in tackling the challenge of managing chronic pain in the United States and elsewhere.